Just because the tests and diagnostic tools of modern medicine show no problem, it doesn't mean there's no cause for your symptoms or illness. There are problems where the cause cannot be found with current imaging or hematological tests. This is likely the case when there are no structural or functional issues, yet you continue to experience discomfort. The issue could very well be at the cellular level. Therefore, the alternative, the solution, might be found in future medicine or advanced regenerative medicine such as cell therapy. That's what I believe. The causes of disease can be classified in various ways, but broadly speaking, they can be divided into structural problems and functional problems. In modern medicine, we use imaging tests or blood tests to find out if there's a structural problem with an organ or a functional problem. Then, structural problems are corrected with procedures or surgery, and functional problems are treated with things like medication or procedures. Improving both structural and functional problems together is the treatment method of modern medicine. Of course, since structural problems often accompany functional problems, for example, structural issues like ulcers, inflammation, ligament or tendon tears, stenosis, deformities, or tumors, can cause functional problems in that organ. It's common to diagnose these structural problems and treat them with medication, procedures, or surgery. Alternatively, there are cases where there are no structural problems, but there are functional problems. In these cases, treatments like medication or procedures can also be helpful. But sometimes you're told there are no structural or functional problems, yet you're still in a lot of pain. And so you often end up hearing things like, "I'm sorry, but there's no specific treatment the hospital can offer you." And because nothing is wrong, you might be told to try psychological counseling or treatment at a psychiatric clinic. For those of you who have visited multiple hospitals for autonomic nervous system issues, this probably sounds all too familiar, like I'm telling your own story. As I've mentioned before, just because the tests and diagnostic tools of modern medicine show no problem, it doesn't mean there's no cause for your symptoms or illness. Instead of thinking there's no problem or it's a psychological issue, we should be thinking there is a problem, we just haven't found it yet. Of course, as diagnostic technology and equipment develop, we may be able to find problems we can't see now. But what do we do to treat the symptoms caused by these currently undetectable problems? This is likely the case when there are no structural or functional issues, yet you continue to experience discomfort. The issue could very well be at the cellular level. We can assume there must be some problem at the most basic functional unit, the tissue and cellular level, and the treatments aimed at improving function at this tissue and cellular level can include things like cell therapy, stem cell therapy, and immunotherapy. Therefore, the alternative, the solution, might be found in future medicine or advanced regenerative medicine, such as cell therapy. That's what I believe. And for these reasons, when it comes to unresolved issues with the autonomic nervous system or other neurological disorders, this is why we at OSANG are interested in, focusing on, and plan to take on the challenge of cells and cell therapy. I believe this is the reason. When we talk about cell therapy, I think it's natural to have doubts and wonder if it's really possible. But if you think about it, when someone has severe anemia or is bleeding heavily, we give them a blood transfusion. This transfusion is also a form of cell therapy. The components included in a blood transfusion are things like red blood cells and platelets, and that's because these are the most numerous cells in the human body. If you think of it as transfusion equals cell therapy, then it doesn't seem like such a daunting treatment, does it? In other words, like blood transfusions or bone marrow transplants, cell therapy has been practiced in the medical field for a long time. However, the cell therapy I'm discussing in this video is different. It's the concept of using your own cells, not someone else's. We extract, separate, and culture them to treat problems in your body for your own health. And I'll be focusing primarily on treatments that use adult stem cells extracted from your own body. Before I explain cell therapy, I think it would be helpful to briefly talk about cells. Even a simple overview of the concept should help you better understand what I'm about to explain regarding cell therapy. First, our bodies are made up of 11 organ systems. Specifically, the integumentary, musculoskeletal, nervous, circulatory, respiratory, digestive, urinary, reproductive, endocrine, and immune systems are the 11 organ systems that make up the human body. Each of these 11 organ systems is composed of a combination of various organs. The term organ might sound a bit technical, but it's the same as what we commonly refer to as our internal organs. For example, the digestive system is made up of organs like the stomach, small intestine, large intestine, and liver. And these organs are made up of what we call tissues, and there are 4 types of tissue: epithelial tissue, connective tissue, muscle tissue, and nervous tissue. Finally, the basic unit that makes up these tissues is the cell. So, to summarize, cells come together to form tissues, tissues come together to form organs, these organs form organ systems, and these 11 organ systems make up the human body. I hope this simple overview has been helpful. So then, how is the cell, the most basic unit of the human body, structured? It's very complex, but to put it simply, a cell consists of a nucleus and cytoplasm. The nucleus contains chromosomes, and these chromosomes hold our genetic information, which is called DNA. Then, in the cytoplasm, which is everything outside the nucleus, we have organelles like the mitochondria, which produce energy, the ribosomes, which synthesize proteins, and the lysosomes, which remove unnecessary waste products from metabolic activity. You've probably heard terms like cell therapy or gene therapy used in the context of future medicine or advanced regenerative medicine. Having a basic grasp of the cell's structure will help you understand what these therapies are trying to accomplish and where. It gives you a better sense of the overall picture. Cells are structures that are invisible to the naked eye. However, dysfunction at the cellular level leads to problems with the function of tissues, which are made up of cells. And problems with tissues in turn progress to issues with our organs. Therefore, understanding and treating issues at the cellular level, the most fundamental starting point, is crucial. For what are currently considered incurable diseases or illnesses with unknown causes, this approach may not be the definitive answer, but I believe it's certainly a valuable alternative worth considering. And I believe the day is not far off when we'll realize that treatment at the cellular level isn't just some far-fetched, nonsensical idea. This is because, starting next year, the Advanced Regenerative Bio Act will be fully implemented, legally commercializing these treatments, not just in university hospitals, but in private clinics as well. Within a few years, I believe the concept of cell therapy will become one of the more widely established and commercialized treatments available in clinics. Furthermore, since this is a new institutional change, it will be accompanied by management and supervision from regulatory bodies like the Ministry of Food and Drug Safety to ensure safety and efficacy. Now, some people might call this a noisy regulatory reform with all the oversight from the Ministry of Health and Welfare and the MFDS. But I see it differently. I believe that by easing regulations while also providing detailed oversight to ensure safety, we can actually reduce the risks associated with indiscriminate or haphazard stem cell treatments. It will be a great help in terms of safety. So, from a long-term perspective, I see this oversight from the Ministry of Health and Welfare and the MFDS as a very positive development. In a follow-up video, I'll briefly go over the Advanced Regenerative Bio Act, and we'll also talk, bit by bit, about stem cells, which are at the core of this regulatory reform. The history of modern medicine is quite long, but the history of stem cell research is not. Research and development into embryonic stem cells, adult stem cells, and mesenchymal stem cells really began around the 1960s. And in fact, things like adipose-derived stem cells have only become a hot topic very recently. So because the history of the discovery and research of stem cells is not that long, it hasn't been commercialized until now, and most of the research has been conducted on animals in a laboratory setting. However, because those animal studies sometimes led to quite meaningful discoveries or successful treatments, research has gradually continued in university hospitals, in clinical settings, at the research level, and in laboratories. In fact, in Europe, other developed countries, and the United States, they've been opening the door to and implementing these kinds of cell therapies since the early 2000s. Korea is also starting now, though we are a bit late. So since the history of stem cell therapy isn't that long, it's recently being applied to help overcome the current limitations of modern medicine, which has focused on, structural and functional problems. And I believe that in the future it will experience even more applications, especially across various fields and industries,